met the MDG target with regards to under 5. There has been progress with regards to maternal mortality and child mortality, but we have not yet met the MDG targets with regards to this one. Because the maternal mortality is now at 454 for every 100,000 live births. With under 5 mortality, I think one is the success that we've made with immunization. The coverage now is above 90. And of course, recently when we introduced the vaccinations against diarrhea and against pneumonia, the new vaccines certainly has helped a lot, because many children die of pneumonia and diarrhea. But also because of the successes we have made in the control of malaria. Deaths from malaria is cut down almost by 60% now. With newborn, we have also succeeded from 32 for every 1,000 live births to 26. But it's not good enough. Come next year, we are supposed to get to 19. I think it could be doable. We may be able. This one we may. But with maternal mortality, it is just too far away. Because we are supposed, come 2015, we should be at 193 for every 100,000 live births. So being at 454 for now, getting to 193 is a tall order. It's almost impossible to get there. It is not right. It is not fair for a woman to die in the process of giving life to another human being. We should not allow that to continue to happen. We should all rise to the challenge and perform our respective responsibilities. So what we are now working on, we have got to do more with regards to maternal mortality. One thing is clear that I think to me is distance. So one is to improve people's access to health care delivery facilities. In fact, what we said, people should have access to health care within a radius of 5 kilometers. The second objective here has been availability of trained healthcare professionals. But we have been responding to that. And third objective is availability of medicines and medical equipment, both for diagnosis and for treatment. But in order to track progress, we created the scorecard. At the launch of that, we called all the regional commissioners, the governors of our regions. So each one of them got his scorecard, and when they are looking at it, some of them got shocked that everything is in the red there. We track progress, and it also helps on accountability as well. So I think the scorecard is a very important initiative, which I think will help us. The civil society can play a critical role in terms of monitoring and saying what is going on, but also they are an important factor for advocacy as well. The same with the individuals. The individuals can make their voices heard where things are not working. They can also make their voices heard where things are working. The issue is not that we don't know what we want, or not that we don't know what needs to be done. Our biggest handicap really has been in terms of the capacity to do it. We are doing something. By our standard, we are doing a lot, because if we increase the budget from 271 billion to 1.4 trillion, it's increasing the budget 7-fold. It's a huge undertaking on our part. It's a demonstration of our commitment to that. But as I said, these resources are very limited. So this is where we want the international community now to complement our efforts. In order to be able to do more, there are still more women who die of pregnancy-related complications. There are more children under 5 who still die, because we are only at 54 per 1,000 live births. We want to get to 0. We don't want to get any newborn die. I'm confident that we should get there. many programs, the UN initiative, WHO initiative, UNICEF initiatives, bilateral donors, governments supporting our efforts. We are not alone in this fight, and I'm confident that we will get there. We'll definitely win. Losing is not an option here. We should not allow children, newborn or under 5, to die of causes that can be prevented. This world has enough resources. This world has enough wealth. This world has enough knowledge and technology to prevent that. Let us all play our part.